Question number 3, Dr. Islam, I have gastroparesis. How do I treat this and what can we do? So let me know in the comments down below if you've heard about this condition called gastroparesis, which is basically delayed gastric emptying. This is when your stomach doesn't want to empty appropriately, things just stay in there and your stomach doesn't want to move. And a lot of people have different symptoms from this, whether it's nausea, vomiting, upset stomach, indigestion, reflux, just not feeling very good, having a very poor appetite. Now there are a lot of risk factors for this. For some people, and maybe if you have diabetes, this can make you at higher risk of developing gastroparesis, especially if you have other complications from diabetes like neuropathy. Number 2 is that maybe you've had a surgery and they cut the vagus nerve, and that can cause your stomach to slow down as well. But lastly, there are a lot of people in which we just don't know the cause for why they have gastroparesis. It's called idiopathic. We just don't know the cause. Now what happens is that the stomach just doesn't want to work or doesn't want to move, and so food just sits in your stomach and ferments, causing gas, bloating, and dissension. There are a couple of ways that we can diagnose this. Number 1 is that typically we'll do an upper endoscopy or an EGD. The whole point of that is to make sure there's not an actual blockage that we can fix to cause that delayed emptying, whether there's an ulcer that's there, whether it's a narrowing that we can open up. The other test that we do is called a gastric emptying study, and this is basically we eat some food and we see how long it takes for the food to leave your stomach after 4 hours. And if it's delayed, this may be something that could be a reason why we can get that taken care of for you. And there are a lot of different treatments that we have for gastroparesis. The most common treatment that we do is dietary changes. Very simple, but it actually does work. Having a low-fat diet will help out. Having a diet that's low in fiber will help out. Having small, frequent meals all throughout the day will help out as well. For some other patients, we may give medications like Reglan or erythromycin. For some people though, we may actually have to do some sort of endoscopic treatment, including trying to cut up some of the muscles inside their stomach. But a lot of different varieties that we can do to help treat gastroparesis.